Today we will be discussing a review, analysis, and impact of the International Council of Nurses position statement on cultural and linguistic competence. My name is Molly Nixon. I am a student of the Department of Nursing, Post-University Connecticut, for class SimPath 405, Reflective Practice, Issues and Trends, being taught by Dr. Kanetta Wiggins. Today is the 8th of October, 2025. The International Council of Nurses, hereafter referred to as ICN, adopted a position statement on the cultural and linguistic competence originally in 2007 and revised it in 2013. The ICN position statement asserts that nurses are responsible for providing appropriate care for each patient they serve. To do this effectively, patients must be able to understand clearly the information that is being delivered to them. Additionally, the patient's culture must be acknowledged and built into the plan of care if it is in alignment with ethical and legal standards. Professional, trained interpreters are key to communicating effectively with a patient in their preferred language. By allowing communication in the patient's preferred language, the nurse enhances patient safety and reduces the possibility of errors. To protect patient privacy and elicit complete and honest answers on sensitive topics, it is important to utilize a professional translator and not rely on patient friends or family members. Various cultures may approach illness with different attitudes and beliefs. It is the nurse's responsibility to be aware of their own culture and values and how these may impact care. While acknowledging the nurse's own culture, they should also attempt to better understand the culture of the patient they are serving. Providing culturally informed care increases satisfaction among patients. The nursing profession focuses on the individual. Each nursing intervention is tailored to meet that specific individual's needs. To attempt to build an individualized, appropriate care plan, the nurse will need to understand what is important to the patient. They must be able to ask questions to both check for understanding of instruction and assess if the plan of care is congruent with the patient's cultural beliefs to promote adherence and favorable health outcomes. The ICN position statement is supported by the first 5 provisions of the ANA Code of Ethics as published on their website in 2025. Provision 1 upholds the inherent dignity and worth of each person. More specifically, it calls for allyship, which is defined by the ANA Code of Ethics as, quote, an ethical duty that requires intentional interventions, end quote. It further states that it is, quote, essential to address health disparities by providing culturally concordant care, end quote. Provision 1 continues to recognize the rights of individuals by stating, quote, health is a universal right and the need for it transcends all individual differences, end quote. Provision 2 of the American Nurses Association Code of Ethics states that, quote, a nurse's primary commitment is to the recipients of nursing care, meaning that the person whose care nurses are entrusted with must come first in all decisions and interventions made by the nurse. For the patient to be considered first, they must be able to be active participants in their care. Communication must be easily understandable between patient and nurse for the patient to be able to make informed treatment decisions. Provision 3 of the ANA Code of Ethics calls for the nurse to establish a trusting relationship with their patients and to promote a culture of safety. According to an article published by the Journal of Transcultural Nursing in 2020, written by Larson et al., quote, language barriers are a crucial hurdle to overcome as they have a negative impact on treatment, safety, and health outcomes for patients. Page 311. If a patient is unable to understand instructions or a nurse is unable to adequately assess for allergies, patient safety is at risk. The same article also states, quote, being unable to have an adequate dialogue led to patients becoming worried and uninformed and jeopardized patient comfort and care. Page 313. Not only does communication through a trained interpreter increase patient safety, but it also promotes a trusting relationship between patients and nurse. Provision 4 of the ANA Code of Ethics gives nurses authority over their nursing practice. Nurses are ethically and legally responsible for actions they take or do not take. Failing to provide a patient with interpretation services or culturally appropriate care is an ethical violation of both the ANA Code of Ethics and the ICN position statement. Lastly, Provision 5 of the ANA Code of Ethics encourages nurses to acknowledge that, quote, nurses are moral agents influenced by a distinct cultural, political, and or spiritual and social values, end quote. Provision 5 goes on to say that while these influences are centered to who each nurse is, quote, this space does not extend to prejudicial behavior, end quote. The ICN states that one of the ways nurses can demonstrate cultural competence is by, quote, developing an awareness of one's own culture without letting it have an undue influence on those from other backgrounds. The need for standards and guidelines for competent transcultural care is demonstrated by statistics that are available on the World Health Organization's website. There are 1 billion migrants globally. This is 1 out of every 8 people of the global population is currently residing in a country that is different than the country they were born in. Due to the large population that will need transcultural care, the World Health Organization established the Health and Migrant Program in 2020, which they refer to as PHM. The World Health Organization's PHM published Refugee and Migrant Health Global Competency Standards for Health Workers in 2021. Some of the competencies that are listed will sound familiar. Competency 1 talks about people being the center of care. Competency 2 promotes agency and encourages ways to help migrants make decisions for their own health. Other competencies promote lifelong learning, using evidence-based practice, and collaborating with others, pages 6 through 11. The global competency standards were formed from a literature review that was also published by PMH in 2021. Common Health Needs of Refugees and Migrants Literature Review. Page 2 of this publication acknowledges that, quote, cultural beliefs, attitudes, and behaviors have a significant influence on health, end quote. But that more commonly, quote, low health literacy has been found to correlate with a higher prevalence of risk factors and comorbidities, lower engagement in prevention activities, and increase hospital and emergencies admissions, end quote. This concept is revisited on page 6, where the importance of educating, quote, refugees and migrants on the health system of the host country, increasing engagement with health services, end quote, is discussed. By educating migrants or non-native speakers in a way that is easy for them to understand on the health system that is available, emergency room visits and hospital admissions are reduced. This literature review also acknowledges that some other key points that are covered in ICN's position statement. On the 5th page, it is discussed that an example of some, quote, female nurses perceiving a lack of respect from some patients with migrant backgrounds, end quote, highlights how gender is perceived differently by some more patriarchal cultures than those cultures where women have more autonomy and are routinely respected as professionals. This demonstrates the need to understand one's own culture when caring for someone from a culture that may be very different. An important caveat in the ICN position statement on page 1 details that respecting cultural differences and adapting care should not result in nursing practice that is in violation of the Nursing Code of Ethics, legal frameworks, or of the United Nations Human Rights Conventions. An example of one such cultural practice discussed in PMH's literature review on page 9 is female genital mutilation. Though this may be a common practice in a migrant's country of origin, it is a human rights violation, unlawful in many areas, and unethical. Female genital mutilation does not promote health or well-being, but needlessly removes a body part from someone who is likely not old enough to be able to give legal informed consent to what is a cosmetic procedure with significant risks and lifelong effects. An article published in the 2021 series of the Journal of Transcultural Nursing, volume 32, pages 310 through 317, details a study from India where the nurses were asked questions regarding providing culturally and linguistically competent care. In the introduction of Interpersonal Communication in Transcultural Nursing Care in India, a descriptive qualitative study, authors Larson et al. Provide their premise that cultural understanding and interpersonal communication create the groundwork for nursing goals, education and compliance, and are essential to safety and high-quality nursing care, page 310. It is also noted that, quote, the complexity of medical vocabulary can exacerbate language barriers, making good interpretation a critical part of intercultural communication, end quote, page 311. This study took place at a hospital where people from other countries travel to for what is referred to as medical tourism, meaning they leave their country of origin for a short time to seek better or less expensive medical treatments elsewhere. The nurses who participated in the study all, quote, proposed that language problems and misinterpretation were the main barriers, end quote, page 313. The nurse respondents in the study noted that having a skilled interpreter was especially helpful in the initial assessment process when, quote, nurses collected vital patient information and ensured patients knew the routines and the practical details of the hospital. Page 313. The respondents also described utilizing this time to ask open-ended questions regarding what was important to the patient and what their expectations were of staff. It was the opinion of the nurses that having knowledge and respect for cultural differences led to greater trust and respect between patient and nurse. The nurses who participated in the study also highlighted the importance of understanding their own culture so they could be, quote, humble in their interactions and avoid imposing their own culture, end quote, 314. The nurses interviewed, quote, viewed language skills as an obvious aspect in their profession, end quote, page 316. All were noted to be at least bilingual, which they felt was an important tool for a nurse. Some had working knowledge of 3 or 4 languages. Of the respondents, some had worked in other countries to better understand cultures and highly encouraged their colleagues who had not traveled to work elsewhere to do so. From the nursing perspective presented in this article, being able to provide culturally and linguistically competent care not only increased safety and patient satisfaction, but also contributed heavily to job satisfaction for nurses. Cultural competence also fosters, quote, positive work environments, particularly in multicultural settings, end quote, according to the article Cultural Competence and Nursing Work Environment, Impact on Culturally Congruent Care in Portuguese Multicultural Healthcare Units, page 1. The article details how culturally diverse teams can have an increase in conflicts and misunderstandings, damaging morale and increasing turnover rates, page 2. As discussed previously, one of the principles of culturally competent care is knowledge of your own culture to allow for the culture of others to be present without passing judgment or imposing one's own beliefs. This skill allows coworkers to view each other with positive regard despite cultural differences. The study suggests that, quote, improvements in institutional support for nurses to engage in culturally competent practices are associated with a more positive work environment, page 12. Not only is providing culturally and linguistically competent care safer for individual patients, but it benefits the health systems and all patients by keeping experienced nurses longer. In an effort to quantify the effect of cultural competency training on patient outcomes, Vela et al. Published Does Cultural Competence Training for Health Professionals Impact Culturally and Linguistically Diverse Patient Outcomes? A systematic review of the literature on the website Nursing Education Today in August of 2022. While only one health professional in a particular study reviewed mentioned communication skills in the open-ended post-training survey, it was found that of those participants, there was, quote, significant increase in the recording of chronic disease risk factor, which suggests improved cultural sensitive communication skills of practice staff, end quote, page 6. Overall, quote, professionals reported that the training was beneficial, end quote, page 1. This review, which screened over 7,000 unique papers, found 5 that fit the needed criteria and lists 46 references, concluded that, quote, inconsistencies in theoretical framework and training makes it difficult to assess the efficacy of training on patient outcomes, end quote, page 1. In order to assess the effectiveness, according to the authors, there needs to be an agreed upon, quote, definition, theoretical framework, and implementation approaches to training, end quote, page 1. In short, to determine if cultural and linguistic competence has long-term benefits, it must become standardized and universally utilized. By publishing their position statement, the International Council of Nurses could provide the tool to do just that. Thank you for joining me for this analysis.